Hello, good afternoon. Many thanks for inviting me to participate in this special technical session. It's very nice to be here. I'm representing two programmes, the One Health Poultry Hub and the CE4AMR network. These are both funded by the Global Challenges Research Fund, administered by UK Research and Innovation, and they involve several institutions from India as part of the programme. These networks are committed to the principles of One Health. This is an approach that recognises the interconnectedness of living things and the shared environment, and that achieving optimal health outcomes or responding to complex challenges often requires the expertise of people from many disciplines and sectors. So One Health is not new. For centuries, scientists have recognised, for example, the links between human and animal health. However, it's now much more important, largely due to rapid human population growth, which brings people into much closer contact with wild and domestic animals, and also the negative impacts of human activities such as deforestation, intensification of farming, poorly planned urbanisation. All of these offer new opportunities for disease spread, as does our global connectivity through international travel and trade. One Health thinking can be applied to any issue that has impacts across sectors, but in the context of this talk, the focus I'm going to bring is on disease threats that come from food producing animals, specifically chickens. So, livestock production has increased remarkably since 1960, with massive increases, particularly in pig and chicken production, and the rate of change in chickens, the rate of consumption of chickens is growing faster now than any other sector. Since about 2000, most of the growth has been in South Asia, particularly in India, which is now the 5th highest producer of chicken meat and the 3rd highest producer of eggs. And over the next 5 years, it's predicted that the compound annual growth rate will remain pretty high at 15% a year. It's been driven by a number of factors: increased incomes, growth in food services, etc. And there's lots of capacity for further growth because consumption is currently quite low compared to other countries. Most of the change has been driven through major transformative change in the industry, with a switch from backyard to industrial production, and that's been motivated predominantly by large commercial companies who are integrators, so who own quite a lot of the infrastructure within particular chains of production, and they've invested a lot in the intensification and industrialization of the process. So intensification allows for much more efficient production, but it's not entirely without risk. And you'll see from this map that there is a very clear correlation between the rate of change of production of chickens with the risk of zoonotic disease emergence. Now, this is not to say that all diseases are coming from chicken production, far from it, but it does indicate that those parts of the world which have got high population density are rapidly increasing the intensification of their livestock production, and are also likely to be places where there are higher risks of zoonotic disease emergence. And when we think about chicken production, there are some quite specific risks, notably increased antimicrobial resistance, the risk of avian influenza, and also significant enteric disease, particularly bacterial foodborne zoonoses like Salmonella and Campylobacter infections. The top level questions that we're asking in the Hub are listed here. We want to know why or how does intensification of production increase risk? We want to know which processes or behaviours are the most risky, and what are the best long-term solutions for safe and sustainable poultry production. To answer these questions, we're using a variety of disciplines ranging from biological, veterinary and clinical science through to a number of different social science approaches. The way we're approaching the questions is addressing 3 levels that map onto the OIE definition of implementing a One Health strategy. First come technical activities, which are focused on the details of the problem. And in our case, this means mapping precisely the networks through which chickens are produced and traded, assessing the flow of chickens and people, the spatial distribution of farms and markets, biologically sampling chickens and people, analysing the diversity of pathogen genetic material from those samples, looking at the input and decay of antimicrobials, generating predictive models of pathogen transmission, and also eventually developing and testing interventions that target the most risky parts of the network. Next comes societal level activities. These are those activities which address complex human interactions and attributes, and we're using ethnographic and economic approaches to generate knowledge of the behaviours of key actors and to quantify epidemiological risk, including the impacts of socioeconomic and cultural constraints. I'm just going to break off here to mention some work being done in the C4 AMR network in India. So a workshop was organised by Dr. Rajiv Dasgupta and colleagues at JNU, bringing together more than 40 stakeholders from across a range of sectors, from public health, animal health, experts in AMR, in biotech, agriculture, community engagement, etc. The objectives being to explore the scope and role of community engagement approaches for addressing AMR challenges across the livestock sector, and to identify gaps in understanding and discuss models of community engagement that have been used in other initiatives. And throughout the day, a lot of really good discussion was taking place, and several very key practical steps emerged that should help to overcome some of the identified challenges. And these, for example, included being really clear about technical terms, demystifying a lot of the data that is presented to communities, being very confident in having good coordination and guiding agencies locally, and being very clear about clarifying the role of stakeholders, what barriers there may be for sectors to engage, and really looking to seek opportunities wherever possible to use community engagement methods. Also in that meeting, there were a number of overarching key priorities that the group felt were critical for tackling AMR in India, and those are just listed here. Just moving back to the hub approach and looking at the final level of activity, we're really talking here about institutional level, which essentially, of course, institutional control lies in the realm of government and those with responsibility for governance, regulation and finance. But we as researchers do have an obligation to contribute evidence and expert opinion to support the processes of government that ultimately will provide the infrastructure and capacity for successful adoption and implementation of policies. And of course, there's lots of different ways to do that, some of them very specific, some much broader based. And I just want to flag up one activity that we in the Hub the past year, and that was a roadmap series that we held of moderated public discussions that actively tackled some of the key issues of sustainable development linked to poultry production, food systems and disease. So there were 18 moderated discussions, and each time 2 invited expert panelists, and we were covering a number of different themes, as you can see here. And each invited expert was asked to provide a small number of key messages. And at the end of the series, after lots of discussion and online chat, these key messages were compiled and clustered into 9 broad, which are shown on this slide. So sitting at the middle, we put the One Health governance and implementation being the future as the key theme right in the centre. But surrounding those, there's a number of other very important messages that were coming through from our roadmap. The importance of having robust and relevant data sets and evidence which is needed for analysis and decision making. A really key role for effective science communication and education. Quite a lot about the requirement for interdisciplinary and intersectoral approaches when you're looking at risk management, animal welfare, antimicrobial stewardship. Things about equity and justice being really important for safe food and poultry production systems, taking into account local perspectives and priorities and cultural aspects of production systems, and also the notion that systems which are nature-based or agro-based are essential for sustainable development. We've taken these roadmap themes a step further to validate them or road test them at national level through a series of synthesis workshops. And in India, this workshop was more than 30 people who were coming from quite a wide range of sectors, but who've been involved in the roadmap discussions. They were challenged to consider if the themes they thought were relevant to the Indian situation, to identify gaps and develop next steps in roadmap dissemination at national level. And here is what they concluded in terms of the top themes relevant to India, and also a very strong appetite for an India National Roadmap series. So watch this space for 2022. I'll say thank you very much for your attention.